XH3002, Summative Assessment Quiz, NAS 3025. Health Assessment XH3002 Clinical Judgment Throughout Assessment. Overview. For this performance task assessment, you will gather data to inform making clinical judgments. Your primary resources for this assessment are 2 interactive media simulations using Mursion technology. You will view the media, have opportunities to engage in structured ways with the featured avatars, and analyze information provided by the avatars. There are 2 types of situations involving clinical judgment you will address: a fellow nurse explaining her assessment of a patient, and a first-time mother sharing details on her 1-month-old son. Using the information you learn, you will complete a template document with a set of guiding questions for each scenario. Instructions. To complete this assessment, do the following. Be sure to adhere to the indicated assignment length. Download the template document, Decision-Making for Clinical Judgment. Download the Academic Writing Expectations checklist to review prior to submitting your assessment. Before submitting your assessment, carefully review the rubric. This is the same rubric the faculty instructor will use to evaluate your submission, and it provides detailed criteria describing how to achieve or master the competency. Many students find that understanding the requirements of the assessment and the rubric criteria help them direct their focus and use their time most productively. All submissions must follow the conventions of scholarly writing. Properly formatted APA citations and references must be provided where appropriate. Submissions that do not meet these expectations will be returned without scoring. This assessment requires submission of 1 file in Microsoft Word. Save this file as XH3002 first initial last name. Decision-Making for Clinical Judgment. For this competency assessment, you engage with avatars representing patients and clinic staff in a simulation set in a community health center, neighborhood clinic. There are 2 separate scenarios, and you will analyze both. Your purpose is gathering data to help inform making clinical judgments. To prepare, access the Decision-Making for Clinical Judgment template document. You will complete this 1 template for both simulation scenarios. Review the document to clarify the required information and analysis for each scenario. Review the Mursion interactive media resources as many times as you need to prepare for and complete the assessment. You are encouraged to take notes on details provided by the avatars. The following recaps each scenario. The Part 1 scenario involves a discussion with fellow clinic nurse, Etsumi Yoshida, about a returning patient whom you are scheduled to see, Mr. Teo Kimura. Use this conversation to gather clues to Mr. Kimura's unplanned return as you listen to understand your colleague's assessment of Mr. Kimura in his initial visit and identify what you would focus on in your own examination. You will not see or engage with Mr. Kimura, so your conclusions about your avatar colleague's clinical judgment will be based on the details she shares. The Part 2 scenario features Serena Miranda, a young, first-time mother who has brought her 1-month-old son, Jorge, to the clinic for an initial and unscheduled appointment. Keep in mind the interaction is only with the mother. The child is sleeping in a car seat outside your frame of view throughout the simulation. For each scenario, develop your responses based on the specific information in each media resource, other learning resources for this competency, and other resources you may identify. To complete the competency assessment, use the Decision-Making for Clinical Judgment template document to record your responses for each part. Your submitted document should be 3, 4 pages plus a reference page. You should address the following: Part 1, Nurse Scenario, Etsumi Yoshida and returning patient Mr. Teo Kimura. Summarize the information you learned from Etsumi Yoshida about Teo Kimura and his previous appointment at neighborhood clinic. Evaluate the nurse's application of clinical judgment based on what she stated and explain your reasoning. In your appointment with Teo Kimura, explain what you would look for and pay particular attention to based on the information you received from Etsumi Yoshida and your assessment of her clinical judgment. What questions would you ask Mr. Kimura to understand his physical symptoms? What questions would you ask Mr. Kimura to understand other factors that may affect his health? Explain aspects of clinical judgment, noticing, interpreting, responding, reflecting that would support assessment and decision-making on Mr. Kimura's health. Are there questions about cultural competence and or implicit bias in this scenario? Explain your thinking. Part 2, Patient Scenario, Serena Miranda and her 1-month-old son, Jorge. Summarize the information you learned from Serena Miranda that would inform your examination of Jorge and application of clinical judgment. Based on this information, what concerns would you have about Jorge's condition? If your concern were failure to thrive, what questions would you ask to understand more? When you examine Jorge, explain what you would look for and pay particular attention to in your examination based on the information you gather. Explain your next steps for Jorge and Serena Miranda based on components of the nursing process and your reasoning. Explain aspects of clinical judgment, noticing, interpreting, responding, reflecting that would support your decision making. Please contact Nursing Assignments Pro for help with XH3002, Summative Assessment, or any other assignment. Email nursingassignmentsprofessor@gmail.com.